Hey guys, welcome to another health talk with me, Bokamoso Mthimkulu. So, today, I'm going to tell you about a condition that is very well known, and that is stroke. So now, stroke is not a nice thing to go through. I mean, like all conditions aren't nice things to go through or to deal with on a daily basis, but the nice thing about stroke is that if you do act fast, the effects of the stroke will be less for you in that moment. So let's, start and see what stroke is all about. Stroke is also known as cerebrovascular accident, and it is essentially just an injury to the blood vessels in the brain, specifically your arteries, and this leads to a reduction in blood flow to a specific part of the brain, and therefore cell death and a stroke. The main blood vessels that are affected in a stroke are the arteries that lead to the brain from the heart. So your neck arteries as well as the arteries in the actual brain. Now remember, arteries let blood flow to specific parts of the body and provide those different organ systems with oxygen and nutrients. So now, in a stroke, when you have a reduction of blood flow, you have a reduction of oxygen as well as nutrients, which can lead to cell death of the brain, bringing on symptoms of a stroke. Now, you have two main types of stroke. You have an ischemic stroke as well as a hemorrhagic stroke. But let's look into ischemic stroke first, and not to over-confuse you as well as myself. So ischemia means a decrease in the blood flow as well as oxygen to a specific part of the body. And an ischemic stroke will then be decreased blood flow and oxygen to the brain by blood clot formation, mainly in the neck arteries or inside the actual brain itself. Now, how does a blood clot form, you ask? So, remember in the past with coronary artery disease and peripheral artery disease, we have the same situation happening here. So what happens is you have an unhealthy lifestyle as an input. This can lead to damage in the actual artery. And when the artery damages, it allows for more toxins to travel in and out as it pleases, also to adhere to the wall of the artery. And the main substance that likes to adhere to the wall of the arteries is bad cholesterol. When this happens, you have plaque formation that forms. So if you think of like a wart or a pimple, you would have that little bulge on your skin. This happens inside of your artery as well. If it's a nice round circle, you'll have that bulge inside your artery. What happens then is that it continues to grow. But yes, it is a bit different to the skin, whereas there isn't really anything blocking it from growing on the skin. There is in your artery. Your artery is only this round, or as an example, it's not actually true, but it's only round like this. So eventually it will block completely. But now, think of you like walking and then you bump that wart or pimple and it breaks. This then leads to blood forming a plug in that area, which is sort of similar to what happens inside of your arteries. The plaque can break as well. And what will happen is you'll have a blood clot forming to plug it, for lack of a better way to explain it. So when that happens, it can lead to this thrombus or blood clot that forms that blocks the artery completely, therefore leading to a reduction in blood flow, less oxygen and nutrients to the brain, and thus death of the cells in the brain and a stroke. Now, this type of stroke does happen over a few days or weeks, whatever, because that formation of the plaque and the blood clot does take longer. But because it happens in such big vessels, I mean, if it blocks your neck, it is leading to less blood flow to the majority of the brain, which can lead to more damage or more deficits after the stroke. But now with ischemic stroke, you also have another situation that can happen. This is when your blood clot breaks, and by being naughty or whatever. So when it breaks, it's called an embolus. So this is like a little blood clot that can flow in bigger arteries, but gets stuck in smaller arteries. Now, if this embolus was to travel all the way up into the brain, it can block those small little arteries in specific points in the brain and lead to no oxygen, no nutrients past that point, and thus cell death of the brain past that point. But that will be a more immediate reaction that will happen because it is blocking that point immediately, and then you'll see the signs and symptoms of a stroke more, but it is not, the deficit, it may not be as bad as that of the first situation that I described. Now, that is ischemic stroke in a nutshell. Now let's look at hemorrhagic stroke. Hemorrhagic, or a hemorrhage, means to bleed out. Now this can happen in your arteries that are situated in your brain. What happens is that you could probably bump your head hard, or you may have weakened blood vessels, weakened arteries within the brain that are subject to rupturing. When this rupture happens, you won't have any blood flowing in the vessel to a specific part of the brain. Like, think of it, if you bump your leg and you have a huge scab and you're bleeding out just above the knee, you're not getting any blood to the rest of the leg, and that part of the leg starts to die. Similar in the brain. When you have that rupture at a specific point, you're not getting blood flow to the rest of that pathway in which the artery supplies blood, and that part begins to die. But now the problem with having a hemorrhagic stroke is that your head is only so big. It is enclosed by your skull, which is bone, which means that all that blood that's seeping into the brain increases the pressure and messes up with the integrity of the different systems and functions and all that within the brain itself, which can lead to not only symptoms of a stroke, but also a dysfunction in the functioning of the brain itself. And so those are the two main types of stroke, how they develop in the body. Let's look at symptoms. Symptoms you're likely to experience is dependent on which part of the brain has been affected. But in general, you're likely to get paralysis, mainly to one side of the body. So this is like a weakening or a collapsing of that one side of the body. You may also struggle to see or struggle to formulate sentences, struggle to think, to speak, to walk, etc. It all differs depending on which part has been affected. The main goals of management is to prevent having another stroke, prevent getting other comorbidities such as diabetes, heart failure, etc. Also to help you regain your independence to do different skills and live a normal life without having to have other people help you all the time. For example, if you're struggling with speech, to help you talk again. If you're struggling with walking, to help you walk again. If you're struggling with getting in and out of bed, to help you get in and out of bed with ease or without having someone to help you. And this is all done by different teams or different professions that do this. So a speech therapist will help with speaking again, as well as swallowing and so forth. A biokineticist will help with increasing your activity levels and getting your heart pumping nicely, as well as trying to help in other areas such as getting out of bed, etc. An occupational therapist will help with writing and just being able to do activities with ease throughout the entire house, like cooking, walking, etc. And there are obviously way more disciplinaries that do help with this. But another thing that is important is your mental health. And this is also done through management, through a neuropsychologist or just a general psychologist, to help you come to terms with what has happened. An ischemic stroke is caused mainly by your risk factors for heart disease and stroke. So this is age, family history, a unhealthy lifestyle by eating unhealthily and not exercising or managing stress, etc. Also other comorbidities such as diabetes, high blood pressure, obesity, etc. A hemorrhagic stroke is mainly caused by an aneurysm. This is a bulge in your blood vessel. This is a weak point there where that bulge is, which can burst and cause bleeding out of in that area of the brain. You can also have a hemorrhagic stroke by malformed blood vessels in the brain. This means that the blood vessels are not strong enough to do its function and may burst easily or break easily if you get hit in the head, etc. With prevention, you want to live a healthy lifestyle. This means eating healthy, eating more fruits and vegetables, and cutting out your processed foods, your fast foods, your sweets, your cool drinks, etc. You also want to exercise. This means increasing your activity level. So walking often. If you want to go for a run, go for a run. And just, keep moving. Keep your joints nice and lubricated. Also, you want to try and stop smoking, as smoking can lead to inflammation as well as plaque buildup in specific arteries within the body. And also decrease your consumption of alcohol, because alcohol can also lead to inflammation in the body. But if you do already have a condition, then managing it correctly by taking your medication correctly or following the doctor's orders is the best way to help prevent getting a stroke. Thanks guys for watching. Don't forget to leave a comment if you have any questions or anything that you would like me to clarify. Don't forget as well that with stroke, what you want to do is act fast. You want to make sure that you get treated immediately, because the longer you wait, the more brain tissue begins to die. And when you act fast, there's a specific acronym, which is FAST, where you can look at specific things to help recognize if you are having a stroke or if someone next to you is having a stroke. So the F stands for face. What you would do is ask the person to smile, and what would happen is one side of the face will droop or won't be able to go up into a nice smile. The A is for arms. What you ask the person to do is lift their arms up, either in front of them or by their sides. And what will happen is the one side won't lift at all or won't lift as easily or as high as the other side. The S is for speech. Ask the person to speak, and if they do struggle to formulate their words or anything, then it is also an indication. And the T is for time. This means you must act fast. Call 911, get an ambulance then, get them to the hospital as soon as possible. But I hope you do have a great week. If you are new to my channel, please do subscribe. Click the bell so you do get notifications when I do upload new videos. And share this video, let people know what stroke is, how it develops in the body, and why acting fast is very, very important. Alright guys, bye.